ಯಾವಾಗಿಂದ ಎಲ್ಲಿವರೆಗೂ ಇದೆಯಾ? ಯಾಕಂದ್ರೆ ಸ್ಟೂಡೆಂಟ್ಸ್ ಕೆಲವರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ. ಸಿ ಇಲ್ಲ ಇಲ್ಲ ಮಾಡ್ಲಾ, ಕಂಟಿನ್ಯೂ ಮಾಡ್ಲಾ? ಕ್ಲಾಸ್ ಇದೆ ಇನ್ನು. Can I continue? Yes. Show your hands. Some response I need. Yes. Ajit, Kritika, Nitish, Syed, Bala. Am I audible? Can you see the slides? Yes.
You can see the slides. You're audible.
Yes, ma'am.
Okay, okay. Mute yourself. Mute yourself. I'll continue. Yeah, Bob. Start. Okay. Coming to the adverse effects of cephalosporins. These drugs like cephalosporins are generally well tolerated, but they are more toxic than penicillin. Okay, usually they are well tolerated, but more toxic compared to that of penicillin. Pain after IM injection occurs with many cephalosporins. Pain after IM injections occurs with many cephalosporins, but some can be injected IM, while others only through IV. After giving IV, there may be the development of thrombophlebitis. Okay, so some are pain can be injected IM, while others are injected only IV. Thrombophlebitis of the injected vein can occur. And next adverse effects like diarrhea. This is due to alteration of the gut flora, and because our irritative effect is more common with the orally administered compounds like cephalexin, cefixime, and cefuroxime. With this diarrhea is more common because of the alteration of the gut ecology or irritative effect. Gut flora may cause alteration in the gut flora, or due to irritative effect causes diarrhea. It is more common with the cephalexin, cefixime, and parenteral cefuroxime. And hypersensitivity reactions. They are the most important adverse effects of cephalosporins. Okay, hypersensitive reactions are the most important adverse effects of the cephalosporins. Manifestations are like similar to penicillin, but incidence is low compared to that of penicillin. Rashes are the most frequent manifestation, but anaphylaxis, angioedema, urticaria, they also may be seen in some cases. About 10% of the patient show allergic to penicillin. They have got a cross reactivity with the cephalosporins. Those with a history of immediate type of reactions to penicillin should better not be given cephalosporin. So better in the case of like when the patient is allergic to penicillin, better to avoid cephalosporin. Okay, these are the pain after giving IM injection, thrombophlebitis after IV, diarrhea due to alteration of the gut flora, and hypersensitive reactions like rashes most common, and also there we can see with the anaphylaxis, angioedema, and urticaria. And nephrotoxicity is with administration with the aminoglycosides or with the loop diuretics, the nephrotoxicity is enhanced. It may be accentuated by administrating with the aminoglycoside or with the loop diuretics. Okay. Bleeding, it occurs with the because there will be hypoprothrombemia. It causes bleeding and is more common in patients with the cancer, intra-abdominal infection or renal failure. Bleeding is more common with the because of it's due to hypoprothrombemia by the same like how it will be in the warfarin, like the same mechanism. It's more common in patients with the cancer, intra-abdominal infection or renal failure. And neutropenia and thrombocytopenia are also rarely seen. And disulfiram-like reaction with the alcohol has been reported with the cephalosporins. Okay, these are the some common adverse effects like pain after giving IM injection and thrombophlebitis after IV. And after orally, there may be diarrhea due to alteration of the gut flora and irritative effect. Hypersensitivity reaction, rashes are the most frequent manifestation with the these cephalosporins, but there may be development of anaphylaxis, angioedema, and urticaria and asthma. Nephrotoxicity can be seen if administered with the aminoglycoside or with the loop diuretics. It is enhanced, and bleeding with the cephalosporin and ceftriaxone. And neutropenia and thrombocytopenia are also rare adverse effects, and disulfiram-like reaction can be seen with the cephalosporin, especially with the cephalosporin. These are the some adverse effects seen in the case of this cephalosporins. So, coming to the uses of cephalosporins, they're one of the most commonly used antibiotics among because they cover wide range of gram-positive and gram-negative bacteria, including some anaerobes, but there is no action against MRSA and other than fifth generation and Bacteria flagellis, Enterococci, mycobacteria. I'll tell you the mnemonic for that, which drugs are resistant, which organisms are resistant to this cephalosporin. Uses of cephalosporins as an alternative to penicillin for ENT, upper respiratory and cutaneous infection. As an alternative drugs, you can use these cephalosporins for the penicillin G, alternative to penicillin for the ENT, upper respiratory and cutaneous infection. Respiratory, urinary and soft tissue infections caused by gram-negative organisms like Klebsiella, Proteus, Enterobacter and Serratia. And it can be, in the case of penicillins producing staphylococcal infections, we can use these cephalosporins. And gonorrhea caused by penicillins producing organism. So in this case, ceftriaxone is the first choice of drug for single dose therapy of gonorrhea. Ceftriaxone is the first choice in the case of caused by penicillins producing organism. Gonorrhea caused by penicillins producing organism. And also we have it can be used in the case of septicemia caused by gram-negative organism. It may be combined with the aminoglycosides. Septicemia by gram-negative organism can be combined with the aminoglycosides. Other uses like attendance save ಮಾಡ್ಕೊಂಡಿದ್ದೇನೆ ಇಲ್ಲಿ ಎಲ್ಲಿ ಕಳಿಸಿ ಈಗಲೇ ಕಳಿಸಬೇಕಾ ಕ್ಲಾಸ್ ಆಗ್ತಾ ಇದೆ ಇನ್ನು ಕ್ಲಾಸ್ ಆದ್ಮೇಲೆ ಕಳಿಸ್ತೀನಿ. In the case of surgical prophylaxis, first generation cephalosporins are the popular drugs, and for the surgical processes such as artificial heart valves, artificial joints, and meningitis. So optimal therapy of pyogenic meningitis requires bactericidal activity in the CSF. So preferably with the antibiotic concentration several times higher than the MBC. MBC is minimal bacterial concentration. So antibiotic coverage should be very high. The antibiotic concentration should be several times higher than the MBC for the infecting organism. And it's generally combined with the ampicillin or vancomycin. Can be combined with the ampicillin or vancomycin. So ceftazidime plus gentamicin. Ceftazidime and gentamicin is the most effective therapy for Pseudomonas meningitis. It is a very, very important use, meningitis. So it is used in the case of optimal therapy of pyogenic meningitis. If they require bactericidal activity and high concentration in the CSF. So this can be ceftazidime plus gentamicin is the most effective therapy for the Pseudomonas meningitis. In the case of typhoid, ceftriaxone and cephalosporin injected IV are the fastest acting and most reliable drugs for the enteric fever. Mixed aerobic and anaerobic infection in the cancer patient, those undergoing colorectal surgery, obstetric complications, we can use these cephalosporins. And also like hospital-acquired infection, especially with the respiratory and other infection in the intensive care ICU. In the case of ICU, there will be hospital-acquired infections. So in these cases, we can use these antibiotics are used. And prophylaxis and treatment of infection in the neutropenic patient, ceftazidime or another third generation compound or alone in the combination with an aminoglycosides can be used in the case of prophylaxis and treatment of infection in the neutropenic patients. Okay, this completes the cephalosporins. And one more within 5 minutes, I'll finish it off. This monobactam. These are also short note questions. In this cephalosporins, definitely there will be we'll get multiple choice questions. More multiple choice questions can be. Okay. ಆಯ್ತು, ನೀವೇ ವೇಟ್ ಮಾಡ್ಕೋತೀರಾ, ಎಂಡ್ ಮೀಟಿಂಗ್ ಮಾಡ್ಕೋತೀರಾ? ನಾನೇನು ಮಾಡಲ್ಲ, ಸುಮ್ಮನೆ ಕ್ಲಾಸ್ ಮುಗಿಸ್ತೀನಿ ಅಷ್ಟೇ, ಒಂದು 10 minutes ಮುಗಿಸ್ತೀನಿ. Okay, so coming to the monobactams. This aztreonam is a novel beta-lactam antibiotic in which the other ring is missing. That's why it's called as monobactam. This inhibits the gram-negative enteric bacilli and Haemophilus influenza at very low concentration and Pseudomonas at the high concentration. It inhibits gram-negative enteric bacilli, Haemophilus influenza and Pseudomonas. It is a beta-lactam antibiotic with a spectrum resembling aminoglycosides. It resembles the aminoglycoside. It is a beta-lactam antibiotic, but okay, and is resistant to gram-negative beta-lactamases. These main indications of aztreonam are. Aztreonam is a very important question. Like it's a short note question or. It can be asked in multiple choice question, objective type. It is very, very important. These are used in the case of aztreonam. It resembles the aminoglycosides. They are used in the case of hospital-acquired infection originating from the urinary, biliary, gastrointestinal, and female genital tract. And there will be 5 minutes. Lack of cross-sensitivity with the other beta-lactam antibiotics is the most prominent feature of aztreonam. So, lack of cross-sensitivity with the other beta-lactam is the important feature of this monobactams like aztreonam. And it's used in patients allergic to penicillin or cephalosporin. That's why it allows the use in the case of penicillin or the case cephalosporin allergy to these drugs. And rashes and rise in serum aminotransferase are the adverse effects seen in the case of aztreonam. Next is the carbapenems. Even this carbapenems also, this imipenem is an old drug and meropenem is a recently added drug. These are all the short note questions. Imipenem. This extremely potent and broad spectrum beta-lactam antibiotic, it includes like gram-positive cocci, Enterobacteriaceae, Pseudomonas, Listeria, as well as anaerobes like Bacteria splizalis and Clostridium difficile. It inhibits the penicillinase producing staphylococci, and also some MRSA are inhibited with. But the limiting feature of this carbapenem is the rapid hydrolysis by the enzyme dehydropeptidase 1 located on the brush border of the renal tubular cells. So this is the limiting feature of imipenem is the rapid hydrolysis by the enzyme dehydropeptidase 1. So to avoid that, to prevent that, there is an innovative solution to this is a combination with the cilastatin. It is a reversible inhibitor of dehydropeptidase 1, which is have got same like pharmacokinetic activity like that of this imipenem. Okay, next drug is the meropenem. This newer carbapenem is not hydrolyzed by the renal peptidase. This is the advantage of this drug. This is not hydrolyzed by the renal peptidase, does not need to be protected by the cilastatin. It is active against both gram-positive, gram-negative bacteria, aerobes as well as anaerobes. Okay, and this is a reserved drug for the treatment of serious nosocomial infections like septicemia, febrile neutropenia, intra-abdominal and pelvic infections. Okay, this completes the cephalosporins and other beta-lactam antibiotics. I hope you all understood. It's a very, very important topic.